41,000 people have died in England and Wales after testing positive for COVID-19. That is because in the last hour, the Office for National Statistics has released its latest death figures up to the week ending the 15th of May. They reveal that 41,220 deaths involving coronavirus were registered. Well, our economics editor, Ed Conway, has the latest on these figures. Ed.
Yeah, thanks, Adam. These are really the most comprehensive numbers that we get on the number of people who have died. And this it's worth emphasising, covers England and Wales. We do have numbers as well for Scotland and Northern Ireland, telling us a more or less similar thing, although the numbers aren't as elevated as they are, particularly in England. And as you say, over 41,000, according to those official numbers, 41,000 people having died of COVID-19, or at least had it on their death certificate. There are also other numbers we get from the Office for National Statistics covering not just COVID-19 deaths, but deaths from all causes. And in a way, those are perhaps a more representative sense of just what's going on overall to mortality in this country, because they kind of show you areas essentially where deaths have actually exceeded COVID-19 deaths. So for instance, over that period, as you mentioned, 41,000 deaths from COVID-19. But if you look at the comparison between the number of deaths that we've had, you normally get in a year, and the number of deaths we've had so far this year, it's actually closer, just looking at my numbers, to 50,000, over 50,000. I'll give you a sense of that if you just look at this chart here. This line here shows you in the past 5 years how many people have died in given weeks of the year. So starting at the start of the year and going through to week 20, which in this case is the 15th of May. And here's the line so far this year. You can see a very big increase indeed. And as I say, this is deaths from all causes. It's not just COVID-19, it is from all causes. But you can see a very big increase here. And then you'll probably remember last week, it looked very much as if this line was going to head down and potentially meet that line. So we'd be back to a kind of average level of mortality in the UK. But instead it's risen in the last week. So we have excess deaths actually rising. Actuaries talk about the idea of excess deaths here. That's the difference between this black line and the blue line there. Now, part of the reason it's worth emphasising really is down to the fact that this is partly about registrations. And in that previous week, week 19, that included VE Day. So that bank holiday, that's an extra day that wasn't available for registrations. And therefore, partly this was a bit too low. And this bit here is catching up on some of those registrations that didn't happen the previous week. So that looks a bit worse than it really should be. But the overall picture, Adam, is that death's not necessarily getting down to what you might consider normal levels. And also, finally, if you look just around different settings, so deaths in different places in England and Wales, you get a similar picture. So this line here, the zero line is just the kind of normal average level in previous years, as I was showing you. We're talking about excess deaths here. This line shows you deaths at home, so in domestic settings. This line shows you deaths in hospitals, so again a very big increase there, and then down to kind of more or less actually below average levels last week, and then rising up to above average levels. But it's care homes really where the epicenter of this crisis is. If you have a look at what's happening in care homes, I don't know if I can show that now. There we are. So care homes, you can see, have peaked even higher in terms of excess deaths, so deaths above the average level, even higher than in hospitals. And still, right now, care home deaths are above the levels that we see elsewhere around the country in terms of deaths at home, deaths at hospitals, deaths in other settings indeed. So this really underlines the fact that it is in care homes that the mortality crisis still is in England and Wales, and a lot of focus will be on that in the coming weeks. And it is a reminder really overall, these numbers, that we are not back to normal levels of mortality in this country, which perhaps is something that policymakers may dwell on when they're deciding just how to end the lockdown, and whether there is still danger of indeed continued mortality and excess deaths around England and Wales and the rest of the UK.
Ed, I do just want to ask you briefly about your colleague, your fellow economics editor at the Financial Times, Chris Giles. He is producing regular projections for the UK, and he's actually saying that the projections of deaths relating to COVID, he thinks are probably something in, the mid-60,000s.
Well, I mean, that's basically excess deaths. So when I talk, what we've got here is excess deaths, and yeah, actually, those numbers, and I mentioned at the start, so you have numbers for COVID-19 deaths, so official COVID-19 deaths, that is around 40,000, 41,000, as you were saying, in England at least. And so if you include Scotland as well, you're kind of getting up to closer to kind of 50,000 just on COVID-19 deaths. But then on top of that, you have to add on all of the deaths that are happening around this time of year that you wouldn't normally expect. And if I just go back to this chart here, you know, about 80% of the gap between those two lines is explained by COVID-19, but that still leaves an extra kind of, it's about 15 to 20% that doesn't really have an explanation. And so that's where the numbers, you know, that Chris Charles at the FT and some people are talking about 60,000 deaths rather than 50,000. It's because you have those excess deaths above what we would expect or what is explained by COVID-19. And some people would say, no, that's going a little bit far because some of those deaths won't necessarily caused by the viruses. Other people will say, well, they're just undiagnosed, and anything, when you take a step back, anything above the average needs to be considered. And I think that, to be honest with you, is closer. I think these numbers, excess deaths from all causes, giving you a real sense of what's going on in mortality in the UK, leaving aside the questions of whether doctors have correctly put COVID-19 on the death certificate, that gives you a more kind of comprehensive sense of what's going on with the number of people sadly dying in England and Wales and indeed in the UK. And when you look at that, you are talking about numbers over 60,000. So COVID-19 official deaths, you're talking about 40 to 50,000 in all of the UK, but excess deaths, so from all causes above what you would normally expect around this time of the year seasonally, then you're talking about probably 60, 65,000 or so at the moment. These are very high numbers. They are far higher than anyone wanted or expected early on from this disease. So a lot of focus will continue to be on these numbers in the coming weeks.